I think the child protection and humanitarian action sector in general is evolving really fast, and we have come a long way from about 20 years ago, or between 15 and 20 years ago, when child protection started becoming a distinct sector in a lot of different organizations. We have come a long way, and we have a lot to do, and I think there will be some significant changes in the next 5 to 10 years. We're using a lot more science in informing our programs, which will naturally change the way we do things, and will allow us to be able to sometimes take a bit of a step back and look at the outcome, which, because of the nature of emergencies and humanitarian settings, in the past we haven't been doing as much. Hopefully we will see more preventative approaches than responsive approaches. Of course, responsive approaches will always have to be there, because that's the immediate, responding to the immediate needs. But we would like to see us approaching child protection more from the perspective of addressing systematically the underlying needs and root causes of harm and adversity, rather than constantly trying to deal with the results. Hopefully that aspect will be strengthened. And naturally, if that becomes the approach, I think it will be easier for us to collaborate with different sectors, because to be able to address root causes of adversity, you naturally have to connect much more with other sectors who basically complement the different components of well-being, but in this case, addressing specifically the needs that, if they go unmet, then they lead to adversity. And all of that should bring us to a point where the humanitarian sectors as a whole, or humanitarian sector as a whole, sees itself as serving a common objective and a goal, which is child well-being and healthy development.
It's so critically important, particularly now that we move in child protection from a position of only responding to problems once they occur to a much more preventative strategy. And what that means is paying attention to the developmental needs of very young children and the families in their lives, so that you're preventing stress, so that you're reducing stress, so that you're providing those social supports that allow families to be able to respond to their changing environment in a way that is supportive to the child's development. Child protection is changing. And I think that the promising signs of that change is a move more to prevention and not just intervention, is a move to pay attention to reducing the exposure to violence for very young children, to pay attention to the enabling environment. You know, we often talk about social protections separate from child protections, but we know that it is those social protections for the parents that enable their parenting to be more responsive to their children. So we also think that child protection is changing and seeing itself much more integrated into the other sectors. So although our responsibility as child protection may be to assure safety and security, part of that is ensuring that children are going to school, that children are going to preschool, that they're getting their health checkups, and that their families are in a situation that can be supportive of their children. So the concept of child protection as a separate sector that's not integrated into health and education, I think has changed. So it's more preventive, it's more integrated into other sectors, and it takes much more of a life course perspective.